Assalamu alaikum. I am Dr. Inam Khan, cardiologist from Islamabad. Last week I presented a case of 4 years old Saudi boy who was successfully resuscitated after near drowning for prolonged period of time. He had cardiac arrest and we successfully resuscitated. This is a rare occurrence and never happens in the due course of your duties. And today I will try to present another case like that. This was again a Saudi boy of 10 years old in the month of March. You see, there was a lot of rain in Hail region where I was working in King Khalid Hospital. Hail is a comparatively cooler place in the northern area. They usually call it Resuscitation, the bride of north. Our people were very good, duties were good. I was in emergency. There were 3 boys, Saudi boys, driving a pickup car, and they were just going out for enjoyment. They saw a water pool around because a short while ago there was rain, so they thought that this water is shallow. They drove with some speed into the pond thinking that this is a shallow water. They went inside and never came out. Some bystanders were there because water and in a pond like shape is a rare commodity, so people were around. They saw that this pickup car going inside and never coming out. They got panicked. Somebody tried to call civil defense services. They reached there after some time, and then they were told that the 3 boys have gone in and have not come out. So they started deliberating. They brought ropes, and some of them they wrapped rope around their waist and went inside the water and frantically trying to find the boy. One of those workers who were inside, he caught cold and was brought to the emergency of King Khalid Hospital. I was the one who saw him soaked in water. He said, I got cold. He didn't tell me what happened and why he has come. Anyway, they keep on searching. Then they find a 10-year-old Saudi boy. He was brought out. He was not breathing. There was no response. There were no resuscitative efforts. They thought he has died, and then they brought this to the King Khalid Hospital of Hail. The other 2 children, dead bodies, were found 6 to 7 hours later. We were 2 doctors in emergency room. Normally we have a 6 to 2 and 2 to 10 and 10 to 6 duties, 8-hour shifts. Normally we had 1 doctor in the morning, 1 during night, and there were 2 in the evening. That day Dr. Matthew, a very noble, very soft-spoken orthopedic, basically specialist but working in ER, and myself. And we had about 4, 5, 6, some Indian, some Filipino nurses. I was, because this evening time is very busy, we divided our duties. If some emergency will come, 1 emergency, 1 doctor will be there. So Dr. Matthew was in the shock room. He received the dead body. I don't know, I was just in the other room and I was seeing my routine patient. We had cabin sort of examining rooms, and from one cabin we'll move to the other cabin. Emergency or not emergency, we'll see them, because to argue that this is not emergency, this is emergency, will waste time. So we decided that any patients who come to ER for something, headache or this thing, we should examine and give him treatment, let him go. I saw one patient, and then while I was examining the other patient, one sister Padmani, his name, Indian girl from Kerala, very good girl. She came in and peeped through the curtain. I looked at her and what is the problem? She said, Dr. Inam, please you come. This was English like this she was speaking. I see, what is the problem? No, but please you come. So I said, how many emergency patients are there? She said, 1. Doctor, 1, Matthew. and nurses, 3 nurses. I said, what's the problem? I just asked her, then she left me, and while I finished examining that patient there, I entered the third room. She came back again. Again peeped through. I looked at her, and then I said, what is the problem? Why you are? She said, please you come. I said, is Dr. Matthew calling me? She said, no. But I said, okay, if he's not calling, then I'm examining. I have to see 16, 17 patients continuously now. Then she left. About 1 or 2 minutes later, she came back again. And this time again, she said, please, Dr. Inam, you come. She didn't tell me what is the problem. So this time, little bit upset, I went with her. There was our shock room. We have many procedures, many savings, many examination in that area. I entered the shock room. Then I saw Dr. Matthew standing beside a listless boy, who later on we came to know 10 years old, with the arms collapsed around his chest like this, and monitor was on. It showed a straight line. So I just asked, what is the problem? He said, this is a DOA. DOA was the standard term which we were using for patients who were brought dead. It was DOA, dead on arrival. I said, I looked angrily at Padmini, and she just avoided my gaze and looked the other way. So by that time, I was just near the shock room bed. I put my hand on the body, just for, not for to see. I find it wet. I was surprised. I said, why he is wet? He told me that he has drowned. I just immediately I got startled, and I said, okay, we'll just make some effort to revive it, because previously, about 2 years back in '89, same March month, we saved the 4 years boiled Saudi boy. So I went up the few steps and started massaging that child. Dr. Matthew came forward and said, Dr. Inam, what are you doing? He is dead. What are you doing? So he even put his hand on my hand, but I continued. I said, never mind. I was smiling. I said, no problem, no harm in trying. So I continued the same way, 7, 8, 9 minutes, vigorous cardiac massage, nothing, no activity from the myocardium of the child. Then again I asked for the adrenaline. It's a very unusual thing to ask for, but I gave that child a quarter cc diluted directly in the precordial area, thinking this will be in heart. I put the needle in, pulled the blood. It was there. I injected, and keep on massaging that child. And about again 1 or 2 minutes later, there was some cardiac activity. I knew this is from the myocardium. 1, 2, 3 beats, then it stopped. Then 4, 5, 6 beats, then it stopped. Then again about 1 minute or half a minute, continuous tachycardia. Then it slowed down. Then after that it started, and it was beating with the increasingly heart rate, and there was ST elevation, very high ST elevation. I imagine maybe 6 to 8 millimeters in the leads which were showing on the monitor. Dr. Matthew also startled and came forward. He was looking surprisingly at that. So at that time, I thought I started feeling the precordial pulsation. His pulses came back, and then there was no breathing effort. We started giving him this Ambubag oxygen, and we continued that, so much so that we could feel all pulses, and the sisters could maintain an IV line. After 2 minutes of cardiac activity, I asked the sister to take blood from BGA, from the arterial radial artery. They took the blood, and we sent for the lab, which later on came around 6.65. Earlier we had the baby we resuscitated had a pH of 6.67, 6. This was 6.65. Never I have seen like that with 2-3 minutes of cardiac activity with oxygen. Never it came to be so low. I already told this last time that in few studies where they had some recovery. They never had pH lower than 6.89. All patients who had a pH of 6.89, either they died or they survived for with significant neurological deficit. This is very strange. I called the doctors from the pediatric department. There were two doctors, Abdul Sattar and the other one I forgot what his name. They came in and they examined the boy there on the sea, saw the pupils not reacting, heart was on. They explained that, Dr. Inam, this is futile effort. This is a boy is dead. This is your resuscitation effort is in vain. And I think my boy has died. I said angrily, I said, you don't give me that bullshit. The previous baby also you are thinking is brain death and he survived and discharged after 11 days. So you please take him. I have done my job. This is your job. Put him on vent or do whatever you want to do. It is your baby now. So they said, no, don't be angry. We'll take him. They took him inside, then kept him on ventilator. They did some suction also. This child also got pneumothorax, which was drained by the chest tube. The boy didn't show any activity for 3 hours. After 3 hours, they elicit little bit pupillary reaction, but still unconscious and remained unconscious. He regained about semi-consciousness in the third day. By fourth day of resuscitation, he regained full consciousness. And then they were surprised. He got full consciousness, and then they started eating and this thing. He was off vent on the third day, and after semi-consciousness, he had a gradual improving Glasgow Coma scale. As I told, on the fourth day, he was fully conscious. This is remarkable. You see the routine thing. They drained the emphysema or this pneumothorax and gave antibiotics and this thing. Again, this child was discharged after 11 days from the ward, and he was little bit hard of hearing. Then the parents also came. The mother told that the child is hard of hearing from the beginning. So you see, there was still no neurological deficit. He was discharged 11 days. Of the 11 days of admission, he came for follow-up 2 weeks later, and obviously was doing very fine. There was nothing, no neurological problem, and unfortunately, he lost to follow-up after 2 weeks. So you see, this is a unique thing. Who can say that they have resuscitated babies of 2 of them by myself after very prolonged submersion. The previous child, I am saying it that this is just at least half an hour's cardiac arrest without any resuscitation. This was even minimum more than that. Going in the water, not coming out, people calling the defense services, they coming in, going inside with ropes, and one of them got sick, got cold and came to emergency. Then they find one child brought without any resuscitation efforts and then declared dead on arrival by Dr. Matthew, very fine doctor. I respect him very much, but it is not his fault. We all think that brought that listless, blue, not breathing, prolonged immersion and pupil fixed dilated. So naturally he said it's a DOA, dead on arrival. But because of my previous experience and this persistence by Padmani, I must give credit to her. I don't know why she was coming again and again to me to please come without telling me what is there. Is drowning or something? I didn't know. So you see, I thought that I must present to you these 2 cases. We have multiple resuscitations. They are normally happening in everybody's life, but this is unique. They were both of them resuscitated. They were prolonged at least half an hour or more than half an hour's cardiac arrest, and still they are living somewhere, inshallah, mashallah, in Saudi Arabia. So this was very strange. Sahel is a comparatively cooler place in the north. It's a very beautiful province. It was governed at that time by Prince Migran bin Abdul Aziz. He was a very fine person. He was a DDP pilot trained from Pakistan. He took care of the Pakistani people there, very fine gentleman. So at that time, Pakistani people were, a lot of Pakistani workers were there. So this happened there, and that we have studied this thing and looked into the literature, and we find that this is a rare occurrence, but children have survived after prolonged immersion. But if anyone had a pH of 6.89, either died or had a permanent neurological deficit. Our children, both of them, they didn't have any, but unfortunately we are not following up for prolonged sequelae problem. Maybe they are still good and enjoying life, because till the last we asked for 3 months from the first baby and 2 weeks from the second boy. They were doing fine. I looked into, and there were Dr. Professor Niaz. He is FCPS examiner from Pakistan, very good friend, like a younger brother. His wife was also doctor, our family friend. We discussed with, and he tried to, we said we will publish these two cases in some in Saudi journals, but it was not accepted and sent back. We asked them, what is the problem? It's a unique thing. They said maybe this is the reason, is actually they are not telling that this will just jeopardize their system of this thing, because both children were brought without any resuscitation efforts. So they will say, some head will roll, thinking that why they have not done. This was 1989-91. I am sure they were not that much strict. Even our doctor, Dr. Matthew, very good doctor, he declared it dead on arrival. And those two Egyptian doctors, Abdul Sattar and another one, they said this is a futile effort, he has a brain death. But you see, this recovered. They are very, very strange, especially with drowning. You see that drowning is the third most common cause of death in all European study. First one is road traffic accident, other one is the burns, third one is the drowning. So near drowning, we use the term when somebody, after submersion in water and coming with the cardiorespiratory rest and surviving for at least some time, is labeled as near drowning. So these are almost two near drowning cases. All studies we have gone through have said that this is possible. Their revivals are there, but most of them, either they died if they have fixed dilated pupils, no respiratory effort on arrival, they are gone, or if they recover, they have some neurological deficit. Our both children didn't have that. 2-3 theories have been forward. One was this, that diving reflex. Diving reflex is a mammalian issue. They said that if you submerge your nostrils, mouth, ears in some cold water, your heart slows down. You have a reference bradycardic, you have bradycardia, and then some oxygenation, some level of perfusion is given to the brain. This has not been accepted, but it is one of the possible theory. Other one was submersion theory, that if you submerge in this thing, then you have a preference, your body cools, because water is much more cooler than the outside temperature. So body cools down, and you have again some protection to the brain with slow perfusion. So I have another theory for myself. I'm not sure this should be told, or this is for just for ponderance, that you see, we all almost had near drowning in our early life when we were in the womb. There is amniotic fluid, and we are swimming in that with not breathing. Our trachea, our system was filled with amniotic fluid, and maybe this thing has something to do with the some saving or some what you call protective effect on children. I am not sure, but this is just a food of thought for the others. So I think this is very remarkable. If you find it interesting, you find it something, and it is, that you please try to spread it to the other people. But purpose is that you should know, you should not be disheartened with just saying that they're dead, cold, not breathing, pupils fixed. Don't just stop it. Now I just remembered, I regret now that our colleague Dr. Khalid was in polyclinic we were in duty in the, I joined Polyclinic in 1983 from Federal Public Service Commission. We were told that his child has drowned. And we said, okay, but I was just there for maybe 1 year or so. So his child was brought. We told them to directly go there to the operation theatre. We all went there. It was about 1.5-year-old boy. So we resuscitated that child. Heart came back. I was compressing with 2 fingers and sometime with the bell of the stethoscope. Heart came out. We saw the heartbeat and this thing, but pupils were fixed dilated, no breathing effort. And as we were not convinced, we kept on doing. Sometime after some time, he will slow down, stop, then again we'll do massage, again stop, and father maybe after some time fed up, he said this is, and everybody is saying this is brain death, brain death. So then we stopped on the advice of the father, and now I regret. I maybe maybe that child could have been saved also if we knew with this conviction as I had at that time, but unfortunately we lost him. This is the thing which should not be disheartened. Keep on trying, especially in drowning, thinking that this may be a diving reflex, maybe this is submersion hypothermia, because this cold water has some calming effect. People have reported reversion of supraventricular tachycardia by just submersion of their nose and eyes and ears in some cold water, semi-cold water. So this can trigger maybe vagus nerve, or through that heart slows down and anxiety goes and supraventricular tachycardias can be controlled. So this is a prolonged presentation. I think you will bear with me and tolerate it because some strong messages are sent by this, and people already there, as much as people who share this and listen to this, maybe they will benefit, inshallah. So I will keep on trying this thing. I want to present a Urdu poem on CPR which I wrote about maybe 8-10 years back. I will come up with that also. Allah Hafiz. Assalamu alaikum.